What do I need to do for the self skin check? If I get a recurrence of a skin cancer, what will it look like?
So skin checks are really important. Being familiar with your skin enough that you are able to provide your medical team with absolute information is incredibly helpful. So, for example, if I'm seeing a patient and I'm doing a skin exam and I question a spot on the skin, and somebody says to me, "Oh, that's been there for 10 years or 20 years, it's never changed." That's very reassuring to me. And I know that I am less likely to have to worry about that spot. If I ask a patient, "Oh, tell me about this spot," and they say, "Oh, I don't know. It could have been there, but I never pay attention," I'm going to think about that spot differently. So, the purpose of skin self exams is really so that you are familiar enough with your skin and your body and your spots that you know if something is new or changing. Interestingly, most melanomas do not come from moles that are on your skin. In fact, less than 40% do. Melanomas are more likely to just show up on normal skin. So if something is new, that's really helpful information. And it's important information to share that with your provider. So the purpose of skin exams is for you to be familiar enough with your skin that you are able to identify new or changing or unusual spots. So as a general rule, it's very helpful to do what we call skin self exams, at least, if not possible, once a month, perhaps once every other month. And you also want to be feeling in your scalp as well. So feeling in the scalp or having a partner be able to look in your scalp, look in your back, and then look in between your toes and in between your fingers. And you're looking for moles or freckles or red spots or pink spots. Skin cancers can look and feel very differently depending on the color of your skin and another variety of factors. So if you are out in the sun frequently and have tons of freckles, and perhaps you have a lot of moles, it can seem daunting to be able to do those skin self exams. But really, what you're looking for is something different, something that doesn't belong there. We call that the ugly duckling. So if you have, say, 15 spots on your back or moles on your back that are light brown and very symmetrical, meaning even all around, but then there's a new spot or a spot that's very dark or perhaps red or it's bleeding, that's different. That's different than the others. That's called the ugly duckling. And that's something that you may want to bring attention to a provider. So being able to identify those spots early are very helpful. So a full skin exam ideally goes from head to toe, and you also want to look inside your mouth. It's important to just be looking for anything that may look unusual or abnormal in the mouth. It's possible to have white spots or brown spots inside the mouth that may be normal. And for many people that regularly see their dentist, the dentist can be a great resource as well. But skin self-exams are part of a strategy to protect yourself. Protect yourself in a way that you could identify a skin cancer early on. So skin self-exams plus seeing a dermatologist on a regular basis together, you are able to determine what may need to be biopsied or what is normal and can just be watched. In fact, we know that more melanomas are diagnosed by the patient themselves than they are the dermatologist. The dermatologist is more likely to find the more worrisome melanomas, but patients actually find their melanomas more frequently. And often will find a recurrent melanoma frequently or a recurrent skin cancer. What I mean by recurrent is that after a spot has been treated, so if a melanoma has been excised or removed or a skin cancer has been removed, and it is later determined to have come back, that's called a recurrence. And a recurrence can happen either right at the site that the skin cancer was removed, perhaps within the scar itself, or in the local area. So if you've had a melanoma, say on your hand, or a skin cancer on your hand, and then a little bit up on the arm, we call that the regional area or local area, or the neighborhood, I like to refer to it. Melanomas or other skin cancers can come back right in the spot it was removed, in the regional area or in the distant area. And unfortunately, they don't always look the same as the original skin cancer did. For example, melanomas are often dark. They can also be red. If a melanoma has been removed and a recurrence is identified months or years later, it can often look very different. And sometimes it can look like nothing. And what I mean by that is it could look like a little blister, or it could look like a rash or a red area or a lump or a bump underneath the skin. So when I'm educating my patients, I always say it's important to pay attention to the scar, but it's also important to pay attention to the neighborhood around the scar. And I encourage people to be feeling the scar, feeling around it, because skin cancers can come back, particularly melanomas can come back underneath the skin or in an area or around it. And we call that a local recurrence. And patients are more likely to identify those themselves. So it is important. Those skin self-exams are important. And also checking the lymph nodes in the area around where you had a skin cancer removed, a melanoma in particular, is helpful. And those lymph nodes are in the neck area, in the armpits, in the groin area, elbows, behind the knees. Lymph nodes are an important part of keeping us healthy. And if a skin cancer is going to spread, it typically will do so through the lymph channels or lymph nodes. So paying attention to the lymph nodes in the area is important. And what you're looking for is a lump or a bump or something that just doesn't feel like the normal surrounding tissue or skin.